Welcome to another production by the Millennial Mechanical Therapist. Your hosts, Dr. Joseph Gravino and Dr. Clay Case, are two physical therapists trying to treat health issues mechanically. Listen further for patient cases, guest videos, advantages and disadvantages of the way they practice, and much more. Thanks for tuning in today. Check us out on YouTube, Facebook, and at our website. We hope that you learn a lot from watching this video and you come back for more. Hey everybody, I'm the Millennial Mechanical Therapist, and today I want to talk about a patient case I had in the past and kind of give you an update today because I ran into her at work. She was an elderly lady that came in with low back pain and radiculopathy to the left anterior thigh. She was very apprehensive at her first presentation to the clinic. She was a walk-in to schedule an eval, and she came with just the phone book of questions. I mean, she had everything that she wanted to ask it that day. So she was very apprehensive, like I said, about coming in and seeing what we're about. So after a little bit of gentle conversation with her, I got her fears down a little bit, and I got her scheduled for her first appointment. And she was scheduled to come in and see me for her initial evaluation. At that initial evaluation, I took her through the standardized McKenzie assessment to kind of get to the root of her low back pain and her radiculopathy and see what we could do and see if she was truly appropriate for physical therapy. She had a lot of comorbidities and other health complications going on, so I really wanted to scan through there and make sure everything was good. As I went through, we found a directional preference for extension. Within about 5 visits, 3 or 4 weeks or so, we abolished her symptoms, and she's been symptom-free since I discharged her on that 5th visit. Now, what I really want to talk about today is that I saw her on my lunch break today at work. I work in a hospital, so she was in getting some other stuff done, and she happened to be eating in the cafeteria. So I sat down and how you doing? What's going on? What's new? And she was telling me that she's been symptom-free, and she understands exactly what she has to do if she ever gets her symptoms back, because prophylaxis, as we all know, should be one of the really primary concerns of our whole treatment plan. But that's not the point of the story. That's more for that on another video. As we were talking today, I asked her how she's been doing, if she followed up with her doctor at all. She said, yeah, I went back and neither of us can believe how well I did. Now, she followed that up by saying, I really, really want to thank you because I feel like you really understood me and really listened to me and knew what was going on. And I looked at her and I said, dear, it's not a big deal. I mean, that's my job. I'm lucky enough to have all this time with you so that I can actually understand what's going on. She said, I feel like I just don't get that with my doctors too much. I said, well, that's unfortunately not their problem necessarily. That's kind of the system. They just don't get much time with you, whereas I get all this time to really listen to you and get down to the root of the problem and hear what your story is. And she said, that was my favorite part when I was working with you, and I want to refer everybody I know to you because I feel like you really took care of me, not just my problem. And that really resonated with me. I really appreciated her saying that, and I truly attribute that to my comfort level and the guidance of the McKenzie system, because the whole focus of the MDT exam is to find the root cause of the patient's problem through listening to their story. None of it's really based on my theories necessarily. If you bend this way or twist that way, I think it's this ligament. I think it's this, piece of anatomy. It's not necessarily the point. The point is to see in life and how you're doing to figure out what's going on there. And when you can say that back to a patient, you can explain their story to them and they go, wow, you really got it. That for me has created so much buy-in on my first appointment. I make it a point on my initial eval. Unfortunately, due to our job, we're stuck behind a clipboard or a laptop or whatever you happen to use, and that can kind of distance the patient. So on my eval, I'd make it a very big point at the end of my exam or my history taking. I put my clipboard to the side, push it away, and I go, can I say your story back to you? I want to make sure I've got it right in my head. Unfortunately, I'm buried behind this paperwork all the time, but I want to make sure that I get it. And most I haven't had a patient that's unreceptive to that. So I spit the whole history back to them, and I ask questions if I forgot. I mean, it's really not that big a deal if you get 98% of the history, but you miss 2%. So I'll go through and I'll say, this started 2 weeks ago, and you have problem bending, sitting for a long time hurts, prolonged standing. Walking for the first few steps feels pretty good, but after that it starts to come on to, and a similar situation comes if you're lying down. Initially you feel pretty good, but if you stay in one position too long, you feel a little bit worse. You just say that whole history back to them. If I forget something, I go, now, when did you tell me you're going back to the doctor? Or when did you tell me you had that, this, that, the other thing? And most patients are happy to say that back because you just said 7 sentences about their history and you know what's going on, even if you missed a little detail. At the end, I go, is there anything I missed that you think is important for us today? And most folks, if you do your job right, will go, I think you hit it all. And at that point, when you hear that statement, I think you got it all right, man. You have so much buy-in right there because you are actually catering to that patient and you're caring for them rather than their problem. I think that's a huge thing for us to do. I really, really do. Take that, take it to work next, if it's tomorrow, if it's Monday, take it to work. As always, guys, move early, move often, and move to end range because that's where the magic really happens.